like all these years, it seems like you've been healing for like decades. Well, you've been healing for decades because you have been healing for decades, because there are certain times, there are things like you're not going to heal all the way right away. All right. There's again, no such thing as accelerated healing. All right. And so what happens is once the healing begins, the healing cannot begin until you treat the wound. But you can't treat the wound unless you identify the wound, and you're not going to be able to identify the wound unless you expose the wound. All right. So the first thing that happens when you have a wound that's bleeding profusely, because you might have more than one wound, but if you got that one wound that's bleeding profusely, you're going to treat that wound first, because that wound is the most intense wound right there. And so what they want you to do is, when it's talking about applying pressure and dressing it up, all right, until you can figure out, okay, what's the best course of action to handle this wound. Now, this wound, because it's the most severe wound, it's going to take a lot longer than the other small wounds to heal. So those wounds, again, may require just some Neosporin, a little Band-Aid, they might require a little, but that deep wound, that can create the most catastrophic, detrimental thing to happen to you, that wound is the one that needs the actual OR. It needs the actual anesthesia. You know what I'm saying? It needs for you, the surgeon, because you're going to be the doctor, and then you're going to have your whole surgical team right there trying to assist you with the wound. All right. And so your surgical team is going to be your guides, your ancestors, your spiritual core, the things that you align with on your spiritual journey. So those are going to be the ones that are assisting you in the surgery. Okay. And so now what has to happen is, once you identify the wound, and once you know which type of wound that it is, now you got to figure out how you're going to heal the wound. So in order to heal a wound, you got to clear the area, right? So you got to isolate this wound. You have to clean the area to expose the wound, and then isolate the wound. So you always see, like in the doctor's room, when they cutting open somebody, they got like all of this blue stuff, all this blue paper or whatever this stuff is, I don't know, surgical cloth over them, and then it's open, and then you see them only operating on the thing they operating on. So if they operating on the heart, you only see the heart. If you operating on the lungs, you only see the lungs, things like that. So knowing what you're operating on, so you isolate the wound, you clean it, you isolate the wound, and then now you're going through the surgical process. Okay, so as you're going through the surgical process, your surgical team is doing all the suction, making sure that you can see the wound clearly. All right. So every time you look, you in there operating on the wound, and then they sucking the additional blood that's filling up in the wound, because that stuff is going to cloud the way you view the wound. That stuff is going to cloud it. That stuff is going to conceal the area, and it's going to make it harder for you to see the wound. So they got to make sure that they keep all of that external stuff from covering the wound, because you might miss something. They don't need you to miss nothing. And because this wound is so deep, and